Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Diltiazem. Its brand name is Tiazac. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Diltiazem works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Diltiazem. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Diltiazem work? Well, Diltiazem is a calcium channel blocker. It blocks calcium ion influx during depolarization of cardiac and vascular smooth muscle. It decreases peripheral vascular resistance and causes relaxation of vascular smooth muscle. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in hypertension or high blood pressure. This medication can be used to treat atrial arrhythmias or chronic stable angina. With respect to contraindications or reasons we would not be able to prescribe Diltiazem, we wouldn't give it to a patient who had a hypersensitivity to Diltiazem or any other component of the formulation. Patients with cardiogenic shock would not use this medication, as well as patients who have second or third degree heart block. Patients with symptomatic hypotension or low blood pressure would also not use Diltiazem. Now what about dosing with Diltiazem? So in the treatment of hypertension or high blood pressure, if a patient was using the extended release formulation, the initial dose would typically be 120 to 240 milligrams orally once daily. The usual dosage range for maintenance therapy would be 120 milligrams up to 540 milligrams once daily, again for the extended release formulation. In the treatment of chronic stable angina, again with the extended release formulation, the initial dose would be 120 to 180 milligrams orally once daily, and then they can titrate this dose over 7 to 14 days up to 540 milligrams once daily if needed. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Diltiazem, so I'll go over some of those here now. 3.5% to 6.5% of patients may experience dizziness, while 4.5% may experience a headache. Peripheral edema may happen 4.5% to 8% of the time, and 1.5% to 3.5% of patients may experience a bradyarrhythmia. A cough comes in at 2% and fatigue at 5%. Now, some more rare but serious side effects would be congestive heart failure or hepatotoxicity. That's all we're going to talk about today with Diltiazem or Tiazac. As always, I'm very thankful you took the time to come by and watch one of my videos. If you find the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description. You can check it as well. So for today, take care.